ahead and get started. Thanks for being here on time and for your energy. I know it's the third day of the conference and it's early in the morning, so glad to hear people are still talking and interacting. So my name is Anna Murray. I'm a Deputy Director of Research with Aquaya. And welcome to our session on targeting WaSH subsidies. And you'll see the little subtitle there. It says an honest dialogue about effectiveness, feasibility, and competing priorities. So I just want to point out the honest dialogue, right? We're here, we often talk about things that are hard, and we kind of gloss over what's hard about them. So we really do want to encourage everyone. There'll be a lot of participation. We want to encourage you to bring your experience and really bring up the hard stuff, because that's kind of how we move forward and how we get better. So just to give you a sense of what we're doing in the next hour and a half, so I'll do just a brief kind of introduction overview, and then we have a few implementing WaSH organizations who are here to share their experience with this topic. So we'll do quick talks from three. There's one pre-recorded and two live presentations. Then we'll have my colleague from Aquaya will do kind of a summary of the work that Aquaya has worked on with WaSH subsidies over the past few years. And then we'll do breakout groups, so you do have to participate for some time, and then we'll come back and have a panel and Q&A. So we'll keep you moving around. Okay, so I'll go ahead and get started. So why are we here? Why are we talking about this topic? So I'm sure many of you know that earlier this year, the JMP launched their latest report on progress within the WaSH sector. And there's with a specific focus on inequalities. So we hear a lot about inequalities, you know, rich versus poor, urban versus rural, different countries. And so we see that these things still exist, right? So keep this in mind throughout this session. This is kind of the problem that we're trying to solve by targeting WaSH subsidies, is to address these issues that are still out there. And before we get into too much of the meat of this, I want to make sure we have a shared understanding of what we mean by subsidies. And so just to be very basic here, subsidies occur when a user pays less for a service than the service provider's cost. So that leaves a third party responsible to cover the difference. So that third party could be a government, it could be other users, it could be future generations, but that is what we mean and how we're talking about subsidies here. And there's many different types. So we're focusing on water and sanitation within this section. We could also have one-time subsidies. So in the case of like a water system, that might mean a reduced connection fee for a user to get a tap to their home. So if the person can't pay the full amount, they may have a subsidy to reduce that price. There's also recurring subsidies. So a recurring subsidy, again, in the case of a water system, may be a reduced consumption tariff. So their monthly fee for water may be subsidized. So we know also that public funding for WaSH capital costs, right? So building maybe big new infrastructure, pipe systems, treatment plants for sanitation, that is also kind of a subsidy. But we're focusing today mostly on households, right? What is the household costs that may or may not need to be subsidized. So in terms of targeting subsidies, as we have in the title of this session, so there's a few motivations that we may have to target subsidies. So first, there's a lot of studies about willingness to pay for households, or ability and willingness to pay in urban contexts, rural contexts, and we just see time and time again that a lot of the costs exclude the poor. So many poor populations are unable to pay for the systems that they may need for water and sanitation, and they may be burdened by also those ongoing tariffs. And many service providers know this. And so they may already be subsidizing consumption costs. So we know that also happens up to a certain level. So second, there's a kind of seminal World Bank report, which was published in 2019. And some of you may have heard of this or read this. But it argues that while subsidies are out there, right, they're pervasive, we all know that they're out there. but that the distribution of these subsidies is unequal. So this report says that in this setting, about half of the subsidies were captured by the wealthiest 20% of the populations, whereas only 6% of the subsidy was benefiting the poorest 20% of the population. So this is sort of like a wake-up aha moment to see, okay, is there a better way to do this? I will say that was data from large utilities, so that's kind of representing larger service providers, which may be, you know, a bit of its own category. And then the third thing is, so we have kind of this gap in WaSH funding needs and available funding within the sector. So there's an ongoing discussion about whether untargeted WaSH subsidies are the most efficient use of limited funding, right? We're all kind of facing those things. And again, particularly with respect to reducing inequalities. So that's kind of the motivations that I think will be good background for our speakers who are doing this work. So without further ado, we'll begin with a pre-recorded presentation, which I will get up here. And this is from Faustina Boache from Ghana Water Limited. She was unable to join us in person, but we will have her remarks.
The Chief Manager for the Low Income Customer Support Department. Hello, everyone. My name is Faustina Boache, Chief Manager for the Low Income Customer Support Department at Ghana Water Limited. It is a pleasure to join you here at the UNC Water and Health Conference to share one of Ghana's most impactful water access initiatives, our Pro-Poor Water Subsidy Program. Water is life, yet for many urban poor families, safe drinking water remains a daily struggle, often too far, too expensive, or simply unsafe. At Ghana Water, we believe that access to clean and affordable water is not a privilege. It is a basic human right and a cornerstone for health, dignity, and development. As the national urban water utility, Ghana Water Limited serves more than 14 million people across the country. But in many low-income and peri-urban communities, residents still depend on informal vendors or unsafe sources, paying far more per litre than those connected to the network. This is where our low-income customer support department comes in to bridge this gap and bring safe water right into people's homes. Through our Pro-Poor Water Subsidy Program, we offer subsidized household connections, reducing the high upfront cost that prevents many poor households from connecting to the network. Thanks to our partners from the World Bank, UNICEF, UN Habitat, the Red Cross, the Netherlands, and the Embassy of Denmark in Ghana, we have implemented several initiatives, including the Gamma Project, the Waterworks Program, and the Water for Life Project. In these programs, connection fees are subsidized by 70 to 100%, depending on location and income levels, making it possible for families who once fetched water from distant sources to have safe, affordable water right at home. So far, Ghana Water Limited has implemented over 35,000 subsidized household connections, reaching more than 300 communities nationwide. We have also implemented technological innovations with water ATM pilots in Accra and Kumasi, which is improving equity and accountability through community-managed water user associations. These interventions have had profound results. It has helped to reduce the financial burden on low-income families. It has also helped to improve hygiene and health outcomes, and also promoted gender equity by easing the daily burden on women and children who spend hours fetching water. Looking ahead, Ghana Water Limited aims to scale up the WaSH Subsidy program nationwide, targeting 50,000 new household connections in the next 5 years. We are working to institutionalize the subsidy scheme through what we call the Social Connection Fund, ensuring it becomes a permanent, sustainable part of how we deliver services. Our vision is simple, yet powerful: to make safe, reliable, and affordable water accessible to every Ghanaian, regardless of income, gender, or location. Because when every home has clean water, health improves, women thrive, children learn, and communities prosper. At Ghana Water, we are proud to play our part in turning this vision into reality, one household at a time. Thank you very much.
So I'll now have another implementing organization, Soil, present. And so this is Maya Lubeck-Schricker. She's been a member of Soil's research team for 5 years and is now the Director of Research and Innovation. She has a background in public health and master's in epidemiology and brings research expertise as well as on-the-ground experience from her time living in Haiti. So come on up, Maya.
Good morning, everyone.
Good morning.
I'm going to try my best to explain what we do at Soil as well as our subsidy efforts in just a couple minutes. So, first of all, what is Soil? We are a container-based sanitation organization operating in urban and peri-urban neighborhoods around Haiti's second largest city, which is Cap-Haïtien in the north. The neighborhoods that we serve are generally characterized as flood-prone, densely populated, low socioeconomic status. And we currently serve, I think we just reached 4,000 households this weekend. So that's about 20,000 people. And households are responsible for paying a monthly fee for our service. That's 350 Haitian gold. That's about, I think, just under $2.70 USD monthly. And our service, and for that fee that they receive a toilet that you can see here, which contains waste in sealable, removable containers. And each month, each week, when the containers are full, households will put the lid on them and set them out on the street, and our staff come around and collect them and transport the full containers of waste to our treatment site outside the city, where it gets transformed into nutrient-rich compost. This sanitation service represents the only safely managed sanitation that addresses the entire sanitation service chain in the region. And it addresses components including human quality of life, dignity, environmental degradation, climate change, etc. So, I will mention our current fee of 350 Haitian goud is already a subsidized monthly rate. That being said, we've done a lot of recent research that has indicated to us that the most vulnerable households are still not able to afford that fee. So our objective in expanding our service is to target the most vulnerable, but we need to answer a couple of key questions before we can even hope to do a targeted subsidy initiative. And some of those questions are, what's an appropriate subsidy amount? And how do you actually define who's the most vulnerable? How do you target those subsidies? So we partnered with Aquaya to conduct a couple of surveys and explore some of those foundational questions. And hopefully we're going to be launching a targeted subsidy pilot early next year, using those results to inform this program. And our plan is to start it among households who are already in our service, who are struggling to pay the monthly fees, and then maybe down the line we'll be able to expand it to new households hoping to join our service. One important note I want to include before I pass it on is that historically in Haiti, many NGOs have provided heavy subsidies for private goods like household toilets and water connections. And that has often created a dependency and undermined both local markets and government authority. And so because of that, the Haitian Water and Sanitation Authority Their current strategy does not support permanent private household sanitation subsidies. And so with our current targeted subsidy work, we're very carefully kind of talking to our partners at the government and navigating how we can move forward together. And so we're very careful to use language around discounts rather than subsidies, and ensure that the financial support of this kind, this targeted subsidy, is short-term with very clear criteria and then with possibility for renewal. So I'll stop there and pass it on.
Thanks, Maya. So now we'll move on to back to Ghana. So we learned about Ghana, now we learned about Haiti. We'll go back to Ghana. I'd like to invite up Joseph Ampado-Boache. He leads partnerships with Safe Water Network in Ghana. And he also has oversight over their commercial services, community relations, analytics, and communications functions.
Good morning, everyone.
Good morning.
It's great to be here. So I'll keep my work short, and I'm going to share with you a bit about Safe Water Network, why this work matters to us, and the little work we've done around a targeted subsidy. Just a little context. So we are a non-profit. We implement locally operated market-based community water supply solutions. We are present in Ghana and India, operating at scale in these communities. In India, operations extend to over 500 enterprises. Close to 2 million people are being served by our operations. In Ghana, we've launched 120 plus water systems in over 150 communities, providing water access to over 600,000 people. Typically, our market, we work mainly in peri-urban areas, small towns, and in some rural communities. Our price is already highly subsidized. We price our water at 2 cents for 20 liters, and typically for our customers, they earn on the average about $1 or $2 a day. And in terms of our delivery models, we deliver water through public standpipes. We also have provide pipe connections to homes, to schools, and also to clinics. So this is how we run our business in our operations Ghana. So what then does this targeted subsidy mean for us? It's quite critical because, of course, for the service that we're delivering and for everything that has moving parts and needs inputs, pricing is key to that. So if we're able to do this, then it positions us to be able to deliver a more affordable water service to the vulnerable population and be able to achieve a greater inclusivity and also expand our market reach. We know, even though the price is highly subsidized, it's not everyone that is able to afford. So this then positions us to be able to reach a larger market segment and get as many people as possible to use our water. If we have a proven solution that is data-driven and works perfectly, it also enables us to minimize distortions to our water market. So what have we done so far? We have worked quite extensively with Aquaya over the past few years to basically identify or look at an objective means of being able to identify the poor. We've moved beyond that and sort of co-developed a pilot. We have successfully implemented that in one community. We're basically exploring 3 types of subsidies. We're looking at consumption-based subsidies for some of our existing customers who have pipe connections on premises. We're also looking at partial connection subsidies for new households that are interested in obtaining a connection. And then for those who fetch from standpipes, we're looking at how to successfully implement consumption subsidies for them. What lies ahead? For us, it's still a work in progress. We'll be happy to have a much more data-driven, equitable and sustainable targeted subsidy solution, which we can then successfully feed into our business model so that in the end we are able to get everyone on board. We don't leave anyone behind. So that is basically what we've done. And we're excited to be here and to be part of this discussion. Thank you.
Hi, everyone. I recognize we're reaching the threshold of presentation fatigue, so I can promise you that I'm the last presentation, and after this we will have a more interactive activity. So I'm here to talk a little bit about what Aquaya has learned over the last 6+ years working with the different water and sanitation implementers you've just heard from, and maybe to hopefully kickstart this honesty dialogue a little bit. So the main objectives of Aquaya's work over the last 6 years have been kind of these broad-based questions that I wanted to highlight really quickly. The first one is asking, recognizing that there are a suite of options when it comes to targeting methods, which ones are actually most effective at identifying the poor. Secondly, once we implement these, what proportion of the poor population are we actually reaching? Are there people who are still being excluded? And lastly, when it comes to rolling out a subsidy program, it is a program. What are those programmatic elements? Are there obstacles to rolling them out, and how can we overcome those? I'll start with the targeting piece. Headline, maybe none of you will be surprised to hear this, but there is no one perfect targeting method for identifying the poor. Each one of these methods has its pros and cons, and I'm going to try to quickly go through them. Not going to get super in the weeds, but happy to have conversations afterwards or answer questions. So I'll start with the geographic targeting method. This is what you will see most commonly applied because it's one of the most practical subsidy implementation targeting methods. It's an area-wide approach. So essentially, you just identify a boundary of a community, a neighborhood, a city, and everyone within that boundary is eligible to receive a subsidy. As I said, highly practical. The downside, as you can imagine, no area is completely homogeneous. So what we have over here is a chart of population distribution by wealth quintile. And as an example from Accra, when you look at the profile of households within communities that were selected to be eligible for subsidies, you see that the wealth distribution of those households is very similar to the wealth distribution of households across Greater Accra. So you still see a lot of diversity. These communities were selected because they were underserved. Their percentage of households that had household connections was very low, but that does not necessarily mean that they are all low income. The other piece that I wanted to talk about are more household-based approaches. So I talked about the area-wide approach. This is now trying to identify specific households within areas. And so the two methods I've highlighted here, one is a community-based method, and this is where you involve the community, you ask households within communities or community leaders to decide and identify amongst themselves who within this community requires assistance. And sometimes they'll identify specific households, sometimes they'll identify categories that they think are valuable. So for example, they might say if a household can't feed itself all year round, then it is deserving of additional assistance. The other household-based approach is a proxy means test. It's a survey-based method. You ask 10+ questions. There are a lot of questionnaires out there that you can use to try and determine wealth based on these proxy means tests. When we apply both of these to the same areas, what we find in comparing these two approaches is that they end up identifying different subsets of the population altogether. And so it's actually really difficult to say one is better than the other. And it's really a question of what definition of poverty do we want to use. And this ends up being a question for that the implementer eventually has to make at this point in time. So how does the implementer then make a decision if there's no perfect method out there? And there's a couple of big picture questions that the implementer has to ask. One is, how much funding do we have and how much of the population do we want to screen out? Because that ultimately is going to affect which approach you use, if you're kind of going with the area-wide approach, which doesn't screen out many people at all, or if you're going with a more discrete household-based approach. There's also acceptability, and this is really, really important. It's, we need to think about the politics of subsidies as well, and we need to think about whether households will accept that they did or did not receive subsidies. It depends on whether you're in an urban context or rural context, what are the politics of the area, and so that will also ultimately determine which method you choose. And finally, I've talked a lot about practicality. I will say, again, this is really dependent. You know, I've put things on a spectrum over here of high and low, but a proxy means test might be super impractical if going door to door is just not within your staff's capability. But if your staff is already going door to door administering things, then administering a 10-question questionnaire is not going to be much more effort than you're already putting in. So it totally depends on what the implementer's existing operations are. Once we roll these, start to roll these out, or like start to evaluate what are the outcomes of rolling out subsidies, you know, definitely subsidies have helped to expand access. You heard that from all of our implementers, that, you know, it's really helping address this inequality issue. But when we do the research and we look at the proportions, we do see that there are groups of poor people that are still being excluded, and it's primarily for two reasons. The first one has to do with just, you know, this is common sense, but distance. A lot of poor populations are just still living outside, especially when it comes to piped services, outside connecting distance to those piped services. And so regardless of what subsidy tool you use, they will continue to be excluded. And so that's something to keep in mind in terms of policy making, especially, that is the subsidy tool the thing that you need, or do you first need to expand your network just to get within reach? The second one, I apologize for the typo, is actually tenancy. So, and you know, we've seen this both in urban and peri-urban areas. Up to a third of households are renters. In most places, again, with pipe services, renters are not qualified to actually set up their own accounts. So, you know, either they're just automatically disqualified, or they have to go and ask their landlords for permission to connect, and that ends up being a whole other barrier that they have to try to overcome to utilize subsidies. So lastly, I talked about, you know, subsidies so far. They're, you know, especially at the moment, they haven't been institutionalized at scale. So they are programs, and they have programmatic elements, and it's really important to pay attention to everything, not just the subsidy price and like who's gonna get it and how do we identify them, but also how are we going to ensure that there is uptake, how are we going to engage with communities, and what are we going to communicate to them. So I just want to make a plug for everyone in the room. Please do not forget community engagement. It is critical to ensuring that the uptake of these subsidies is successful, and that, you know, we're addressing any distrust between customers and the service provider, making sure that doesn't come in the way of people actually utilizing services. Another thing people don't often think of are short implementation timeframes. They don't, again, inadequate staff. These are all things that need to be taken into consideration for rollouts. And finally, this again might seem like common sense, but I wanted to make sure it was a part of the discussion. There are a lot of different players and actors when it comes to you know, rolling out these subsidy programs. You have donors or lenders, you have government officials, you have service providers, and each one of these players and actors has different objectives, different interests. Ultimately, we all want to expand WaSH access, but within our silos, there are specific objectives. And this is actually directly related to the participatory exercise we're gonna have you all do next. But before I get to that, I wanted to pause and just allow, I know I covered like a lot of information, our partners covered a lot of information, so we wanted to just allow for 1 or 2 questions before we introduce the participatory activity. Sure. Yes.
Hi, welcome to Aquaya. This is super useful. I wonder with the targeting methods, did one of those categories include kind of using secondary data, like social connection categorization, to be able to do something scale? So like in some of the sanitation subsidies in Southeast Asia, I think this week, focus on that as something that, like, a cost efficient, rapid, and kind of socially accepted recategorization. So was that already?
Yeah, that's a great question. So I think if I understand you correctly, the question was that how does secondary data and utilization of secondary data, how does it play into the targeting methods that I was talking about? I know in Southeast Asia, especially if I'm remembering correctly, there are government programs that have already been instituted to try and identify the poor for social services beyond WaSH. And those are trying to be, WaSH service providers are trying to use those to identify the poor for themselves. I think that is an excellent point. I didn't bring it up because in the context that we've been working in Ghana and Haiti, although Ghana does have the LEAP program, which is again a government instituted and rolled out, it hasn't actually reached much of the population yet. So in our study areas, when we ask someone, are you enrolled in LEAP, we get enrollments of less than 2% of the population we're surveying. So unfortunately, that can't be utilized everywhere, but absolutely, if it is in place, it is a very cost-efficient method to try and identify the poor.
And I'll just, is this on? I'll just add a little bit to that. Aquaya first started working in Ghana with Safe Water Network, looking at these targeting methods, and we did look at that LEAP program. And another one of the issues was just trust in it. So even when you speak with some of the folks that are administering the program, they're like, oh, that's so old, we don't trust those lists. And so a lot of the belief in that those are the correct poorest people, it just wasn't high on the trust category.
Yeah, a lot of hands. Maybe right here. Jay, right here at the back.
Thank you very much. My name is Jen, and I work with IRC in Uganda. I have two quick questions. You referred to governments having some kind of direction or guidelines.
Mm-hmm.
Are they in policy?
Mm-hmm.
Are they in the law? Where exactly are they?
Mm-hmm.
And how do they read? Because I work with National Water closely. I'm not an employee of National Water, but I know they have a very strong pro-poor strategy, especially in their towns and in the urban areas, but the challenges are very big. How do you really identify a vulnerable household? If they say who is poor in one of our slum areas or a peri-urban area, everybody will come and say, oh, I'm poor.
Mm-hmm.
So the criteria, what kind of criteria? And if it's not put in a policy or in a law, it's very, very hard to even get facilitation or money for it, because these are government agencies. And then my second one is, how are you working with the communities, the community leaders? Where I'm born, not where I stay, where I'm born, we grew up knowing which households were actually poor. And probably it wasn't written anywhere, but we would say that particular household, there's an old woman, an old man, the family has lost probably all their children, you look at the house, you look at certain things, and the community leaders, right from the ones we elect, the church leaders, the mosque leaders, they will tell that household, they are poor. And we would go out of our way, guided by our parents, to support them. Go and fetch water for the old woman. Go and fetch water for this household. You know, they are sickly. There are certain things that we would use to tell. How is that connected? How do you connect to that level so that you really select the ones that need? That they will also know the wealthy people, the ones that have, are the ones that are normally first in the line to say that I also need.
Yeah.
How do you manage that?
Thank you. No, that's a very important question. In terms of the first one for government and how are they playing a role here, so this is going to vary country by country. And I think Maya talked a little bit about the regulator in Haiti, and subsidies are not. I should also say when you talk about government, it's important to distinguish regulators from policymakers. So the policymaker, which might be a ministry, is usually, for example, in Ghana, they put out a document which is like a WaSH guidance document for the next 5 years or 10 years. And they might say in there that, we're encouraging we've created a pro-poor policy, or we are working towards a social connection fund. So these are really kind of broad policies that they define in their documents, saying that, poor people, connection fees should be subsidized for poor people. But it doesn't go much more detail than that. They don't identify who is the poor, they don't identify what the price should be. Regulators are the one, and this is, for example, the case in Ghana with Ghana Water. When they set tariffs, the regulator has to approve it. So the regulator is the one who's monitoring how much subsidy is going, is going into the recurring subsidy, and they are the ones who are trying to take into account both affordability as well as operations and maintenance and financial sustainability. On your second point about the communities, I mentioned there's a community-based targeting method where we, like the service provider would go to the community leaders and say, who in this community is poor? And this really depends, it's different, the response that you get will differ in a rural area, in a peri-urban area, in a small town, in a city. And the thing is that it can be, in an ideal world, they would say, we know who the poor are and here they are. In some context, local politics is also at play. So the local leaders don't want to be the ones held responsible for picking the poor, because then everybody else is going to come to them and say, you picked them and not me, why? So we've actually had community leaders tell us, no, we want you to do your survey. We don't want to be the ones to pick the poor, because then we're going to get the backlash. So it can vary, but just because a community is there doesn't mean they want to be involved in the targeting process. You really have to ask them what they want. Maybe one last question, and then we'll go ahead. Sure. Sorry, Sasha.
Nick Holtzler from Meta Smart Center Group. I have a question. You have subsidies for the services. Do you also have experience on subsidies for products like toilets, pumps, filters, etc.? I'd like to share a very short experience on the question who. In Malawi, I know of a project where they target poor women for water filters. And it was, of course, difficult to see who is poor and who is not. So they changed it to pregnant women. So now there's a clear target, but we can obviously see who is pregnant, not who is poor, but who is pregnant is easier to see. So they targeted, and they used a voucher system to avoid the distortion of the market. So the women goes with a voucher to the shop, and then you don't distort the market, then you build up the market. So that's an interesting experience.
Yeah. Yeah, I know a lot of our conversation so far is focused on the water or the pipe systems and not on specific objects. So thank you for bringing up the more asset-based subsidy question. We have worked also, Aquaya's done some work on vouchers for toilets, specifically in rural areas. And yeah, I mean, I think the targeting issue though, the targeting issues I talked about are very similar. They're still the same. I know you mentioned that, you picked an indicator that was easy because it was visible and people couldn't, it would be harder for people to lie, basically. I want to say one thing. I mean, I did mention the community engagement part. Another reason to do engagement and to really be embedded in communities is for your own benefit of getting honest responses. We have seen that when there is less engagement about something with the community, the answers that you get to the same questions 6 months apart are going to be different. So that's going to make you wonder if, which one was correct. Were people telling the truth? Are they lying before or after? So if you really want to increase the probability of getting honest answers from people in survey-based approaches or whatever categorical or any indicator that you pick, it is really important that people understand, like, what is the purpose of the questions you're asking me? What are you trying to do? So I know that's not exactly an answer to your question, but I did want to point that out. Okay, I'm going to move on to our next activity. If you have any other questions for us, please feel free to come up and talk to us at the end of the session. We'll be very happy to do that. All right, so, and I know this is where we lose half our audience, but I'm going to try to keep you around anyway. we're going to do a bit of a role play activity. We're going to ask you all to break out into groups of 5 or 6, 7, depending on how easy or not it is for you to stay in your place or find a place in this room. And we're going to ask you to, I know it says the paper in front of you, we'll just pass these out in a second. But we're going to ask you to assume the identity of an actor that I was just talking about. So I mentioned there are different actors who are involved in subsidy decisions. And we're going to ask you to assume the identity of one of them and think through the questions that they would think through. Think like them. And the purpose of this activity is that I want you to think of, assume the role of up to 2 actors and think about how their interests may or may not clash, or how are they misaligned. And as you're thinking through this in your group and talking about this, our goal is that we're not going to have a kind of report back from your group sessions. What happens in your group stays in your group. But what we are going to do is we're going to ask you to, at least by the end of the time, have one question that you can ask our panel that's going to come up after this breakout activity. So your group should articulate one question from your discussion for the panel, and our panel is going to be everyone you've heard from today, plus one more person who's going to give us more of the donor lens. So we have, I'll start passing out the papers, but I just want to tell you who the actors are. So we have a service provider, we have a donor, and we have community leaders. Those are the 3 roles that we are giving you an option to select up to 2 of them. You won't have time to do all 3. And all of these, we want you to consider that all of these players are acting in the same system. They're in the same context, same policy, same everything. For the service provider, we want you to pretend you are a government-mandated water service provider that operates roughly 20 piped water systems in rural and small-town communities. You collect revenue from customers, you rely on external funding from donors and government to fund your capital costs and operating costs, but you want to increase your number of customers, and you want to be in line with the National Water Ministry's new pro-poor policy. What are your concerns? Assuming funding is available, will implementing subsidies impact any of your other competing objectives? So that's the service provider. The donor, you work for a foundation. Your foundation has 5-year goals, including ensuring that 50,000 new people in your program country have access to sustainable, safely managed water services. You're funding the expansion of piped water systems, and one of the service providers you are funding suggests that they need additional funding to subsidize the fees of household connections. What are your concerns in providing this additional funding? Lastly, community leaders. You are an assembly person elected to represent and govern a local district with a population of 10,000 people living across small towns and rural areas. On your visits, you frequently hear complaints about mechanical issues with standpipes and the expense of connecting to the new piped water system. The local water service provider has informed you there's donor funding to provide discounts to poor households. Do you have any concerns with providing subsidies to some people and not others? So, with that, I'm going to ask you all to start breaking up into groups of, roughly 5-6 people. You can have more. This room is pretty full. Pick a spot, any spot, and we will come around. We will spread ourselves out amongst your groups, so you'll see some of the speakers there, and we'll regroup in roughly 20 minutes. Okay, I'm gonna, yeah, do you want to?
Water supply and the water service provider just told us there's a donor funding and subsidies, and that was a concern with providing subsidies for some people who not yet received I'll start by proposing that yes, it has concerns. Written them in the US. Micropolitics is really fast. This is what it's all about. So I would have concerns for small place landing where my cousins or nephews I probably want the subsidy, but I don't want to be I was just elected.
What was mentioned earlier, like not wanting to be a part of the process, not assuming anything. Maybe if it's 150 people, it's a lot easier to say like these households, but 10,000.
Or just to put it?
There are much reasons to go out there.
Oh, yeah.
And if people don't pay, are you going to tell them to pay instead of and there's connections, so the connection costs are there and
Thank you.
I feel like you just leave them and they might never solve it.
Yeah, I know.
No, they'll never solve it. No, but it was a great way to close it. The class is engaged. Yeah, no, I always saw two people so that I was thinking standing at the door and looking at them. There was a time in college I was a bouncer. I know I realized it looked like a bouncer and I had to business for for my, like the one of the parties in the it was a football player.
Do you want to announce one more minute so they can wrap up their thoughts?
All right, everyone can start wrapping up your thoughts. And we'd like you to come back to the group in about 1 minute. So start wrapping up your thoughts in your group.
We're like the white boys, you know, we're like
All right, you have 30 seconds to finish your sentence. All right, turn your chairs back into their rows. All right, welcome back. Welcome back, everyone.
Will you call them up or should we just go? Yeah, just call
Doesn't matter where I sit?
Yeah.
Should I sit under my photo? Oh, sure, good. There we go.
No, I think you have to sit here. Anna's gonna sit.
Okay.
Yeah. No, I was too late. If they can't figure out who you are, they need to wake up.
discussion. So this is our chance to now ask people in the panel. All right, class is back in session. All right. Okay, everybody is so excited about this topic. It's amazing. But now you have to be quiet. All right, all right. All right, we have time for our last part of this session. And I'm very impressed by the lively discussion. This is amazing. So I'm glad that this is of interest and people are finding things to discuss. So we have, for the last 20 minutes, now we have everyone up here who you've heard from, plus one additional panelist. So we're adding Louis Borston, who's a managing director leading the WaSH program at the Osprey Foundation. I should also say that we submitted this session also in collaboration with the Conrad and Hilton Foundation. They unfortunately couldn't be here today, but we also have some remarks from them. So they're also a kind of add-on participants in this part of the program. Okay, so now I have a few questions that we'll ask the panel. They'll give some short responses. We hope, again, lively discussion. Honest conversation, and then we'll also, when we're done with these questions, we'll open it up to the audience. Some of you came up with questions in your groups, so we'll take some of those as well. All right, so to start, we'll kick it off with the funders. So we've heard a lot so far from the implementers. So I hope you're ready. But I'm
fine.
So the question is, how do donors think of funding subsidies as different to or related to other WaSH funding? And I'll give you a minute to think. I want to share a little bit about from the response we got from the Hilton Foundation as well, which I will say we had a pre-meeting about this, and their response was remarkably similar to Louis's comments. So I'll kind of give you their sense, and then Louis, feel free to add on. So the representative said, I cannot speak for all donors, but we at the Conrad and Hilton Foundation think of subsidies this way. Evidence so far shows it's very hard to ensure operational cost recovery to deliver sustainable drinking water services to citizens in rural areas. And this is noting that CapEx is fully funded through grants. So an example that he gave was that to deliver safe drinking water in hard-to-reach remote communities in rural Ghana, our grantee, Saha Global, who's also here, reports that a subsidy of almost $4 per capita per year is required to cover operational costs only. So that excludes the capital costs. And so to sustain water services in rural areas and keep tariffs against services affordable for rural populations, it's important for donors like the Conrad and Hilton Foundation to fill that financial gap between costs and revenues by subsidizing services until either operators achieve enough scale to reduce their marginal costs and also invest in improving their efficiency to balance the costs and revenues. All right, so Louis, do you have anything to add to that? Again, the question is, how do donors think of funding subsidies as different to or related to other WaSH funding?
Thanks. So those were Nabil's comments. Let me add a few things. First, one of the things I love about this session is really made me think more about this. And I think that's one of the great things about this conference, is it gets researchers and practitioners together to think a little more deeply about these things. Is this working? Okay.
Yes.
So when I was asked, do we think about targeted subsidies? We certainly think about subsidies a lot. We think about what it costs to get people these services, just as Hilton does. And in seeing the presentation from Aquaya, I realized that really we choose the organizations and ventures that we support in large part because they are serving underserved communities. So there is an element of targeting in that, and I'd say that of the typologies up there, the geographic is probably the one that is, most often comes to mind, because they're choosing to serve places on that. Now, that's not fully targeted, but there's a targeted element in there. Second point is that this matters to us, to Osprey, because of how we define success in the WaSH sector. We don't define success as getting somebody first-time access to a piece of hardware or installing a well or a toilet. We define success as getting underserved communities safe, affordable, sustainable, and scalable services. That is an ongoing service. It is not one-time access to a piece of hardware. So if that's what matters to you, you think about costs a lot. And you don't just think about costs as the capital cost, you think about the life cycle cost of getting and sustaining those services forever. So if you're thinking about cost, you're thinking about how do I keep cost, as Nabil was saying, how to keep costs as low as possible? How do we continue to improve operational efficiency to get them even lower over time? And effectively that means how do we minimize subsidies? We also think about where those subsidies should come from. Often it is foundations like Osprey or Hilton that are helping organizations to figure this out in the initial stages of their operation, because they're learning how to do this. Typically, we've seen a transfer of the subsidies as the ventures grow or as the organizations grow to bilaterals or other external funders, but eventually the subsidizer of record has to be the government. That's their job. These are public services. These are providing public benefits. And that's a challenging issue because so often what happens, you start out, you're not, really not sure exactly what you're doing. You learn what you're doing, and by then the government has come to expect that they're not paying for the service. So you have to figure out how to change that. Two other quick comments here. We think a lot about pricing and what the amount is being charged to the communities and the households that are getting the services. And we think about that because the folks that we work with think about it a lot. And we have noticed a trend with several of the organizations we fund, including Saha and Fresh Life, another group called Earth Enable, where there has been a conscious decision to say, we want to maximize impact. We want to reach as many people in the community as we can. And we're going to prioritize maximizing impact over maximizing the amount we can get from each customer. And that they've made a conscious decision to do this. That probably means that in the long run, the amount of subsidies needed is greater, but the coverage and the impact is also greater. Finally, we do have some experience with targeted subsidies. I was in Rwanda, I think it was last year, with our grantee Earth Enable, which works on flooring and other aspects, and we sort of sneak flooring in under hygiene, for good reason. But they were able in Rwanda to access a government database on who was poor and who wasn't. And they were using that government database to decide what level of subsidy would be allocated to each household. And I mean, it was literally, they had an app on their phone where they could look up the household, and even if the household had moved into an area, they could find them in the place they were living before, and they had an idea if they were below the poverty line and should get a larger subsidy. So there are situations where government can help with this. Thanks.
Great, thank you. All right, so now we're gonna shift to the service providers that we heard from earlier. And the question, I will start with you, Maya, from Soil. The question is, how do service providers navigate the trade-offs between targeting accuracy and efficiency? So in other words, the resources required for that targeting versus, how accurate is it?
Yeah, so I'll start off by saying, again, we're still very much in the thick of this process and figuring all of this out. Our service model does involve a lot of frequent household customer interactions anyways, through payment collection activities and waste collection activities. And so there is a little bit less of a notable operational burden to have our staff add a few more questions during their visits, compared to other organizations that might more rely on like one-off big data collection campaigns. That being said, the current approach we're exploring is 16 questions, some of which involve some observations. And so that will involve very careful training and deployment of our staff, especially if the pilot we're considering is among existing customers. We have to figure out, is it reasonable to ask our staff to go back to all of our existing customers and collect that data before we even consider new households? So definitely an ongoing conversation for us. And just one final point on this is, we also see a lot of value in kind of data collection as a touch point to strengthen our customer relations. So even if it's not purely efficient from the targeting subsidy perspective, we're also viewing this as an opportunity to strengthen our relations with households who are in our service. Yeah.
Thanks. All right, Joe, same question to you. How do service providers navigate the trade-offs between targeting accuracy and efficiency?
Yeah, it's very much the same way. I mean, I believe for most service providers, there's already a system in place that allows us to be able to know our customers and the various means by which they are accessing the service. So for us, it will be about being able to have a mechanism in place that allows us to be able to get this information in a more cost-effective way, in a way that does not add on to our already very challenging economic situation in terms of being able to meet our growing costs. So once we're able to clearly do that in a way that allows us to objectively know who then is poor and who can benefit without necessarily introducing maybe a new layer of cost or a new layer of resource requirement that is needed to be able to do this, then we believe that puts us on a more sustainable pathway into getting this done.
Anything to add, Molly?
No, just looking at time, I think let's move on.
So let's stay with soil and Safe Water Network for another one. And maybe Joe, you can start first this time.
Okay.
All right. What is your measure of success when tasked with implementing targeted subsidies? And keep in mind, they're both, sort of in pilot phases here. So this is a good time to think about what, at the end, how are we going to know if it worked? How do we know? What's the success?
Good. So as a market-based solution, ultimately we want to have a financially viable service. So in as much as we want to be able to reach everyone, we want to be able to do that in a way that ensures that we are still able to cover our costs. So it is still going to be the same revenue pool, but is it possible to be able to leverage the revenue that we're currently getting from the service to be able to cover this additional cost? So that is one thing we'll ultimately want to look at. If it certainly distorts our finances, we may have to rethink through that process again. We will also want to look at market penetration, because these are obviously people that did not have a service, and we are going to extend water services to them. So if it deepens our market, it improves our market penetration rate. That is obviously one measure of success that we want to look at. And then maybe last but not the least, we will expect a system that people do not remain on the subsidy for life. It should allow for people to gradually sort of graduate from that and be able to get into paying what the full price of the service is. So that then gets back into having a data-driven process that allows you to easily identify who then is poor on an ongoing basis, so that you can always sort of fine-tune who gets to benefit and who does not get to benefit at a point in time. These will be our measures of success. And as you already indicated, it's a pilot phase, so we are open to exploring all the options that gets us there. Thank you.
Great. Yeah, I can add on to that a little bit from our perspective. One of the metrics that we've spent a lot of time looking at is customer payment behavior. So are households regularly paying their monthly fees on time? And we've found that generally households that have worse payment behavior, it's because they have lower financial means and they're struggling to just be able to afford the service. And so to us, over time, an improvement in payment behavior with less staff follow-up, because right now we spend a lot of time and money for our staff to go and collect these payments from households. So over time, if we're seeing an improvement in that behavior with less of the staff follow-up, that would be a huge win for us, and also kind of indicative that a targeted subsidy is doing its job in making the service more affordable for the vulnerable households. The second metric that we're considering looking at is reasons why people leave our service. It happens, but we want to see the reasons why they're leaving, the proportion of those people reporting that they're leaving because of financial stressors or economic reasons. We want to see that go down over time to indicate that they're leaving maybe because they've constructed a different toilet or something, but we don't want it to be because of financial strain.
Great, all right, Halima Lad, you have 30 seconds.
Organizer's privilege. No, I wanted to say, I do think that, in terms of measures of success, I want to point out some discrepancies that we've seen as a learning partner over the years. There's so much literature out there talking about how tariffs, especially lifeline tariffs, which are subsidized with the thought that they're going to benefit the poorest people, are not actually doing that. They're not making that change. But when I talk to service providers, I'm not usually, they're not bringing that concern to me. They're not saying like, oh, the people who are using the lifeline tariff aren't poor. But when we start talking about one-time discounts, the service provider is like, oh, but what if the wealthy benefit from this? And I'm like, well, I want to push service providers to think a little more, why is one thing an issue and the other thing is not? Like, when do we really care about errors of inclusion, of including the wealthy, when there are certain times when we think of it and then there are other times when we don't. And I think that it's up to all of us to really balance that out. Maybe reduce the thinking of like, maybe just balance it out and think more about when we ask these questions and asking it across the board and not only for one specific thing.
Great. Okay, I don't know how, we only have 5 minutes left, so I'm going to switch it to your audience questions. If anybody came up with something in your groups or something from before that you're dying to ask, raise your hand and we'll bring you a microphone. Oh, there's only one microphone.
Yeah.
Great, thank you. Our group had a question for the panelists on, so how do you consider the results/consequences of a poor household using that asset to lift themselves out of like that category that defines a subsidy, and like with the potential community cohesion implications? Like basically someone gets a household connection that's subsidized, they use that for a major income generating activity very rapidly potentially, or they sell to their neighbors at increased, like they get it for $5 per, they sell for $10 and jerry cans. Why are service providers happy? But then like the rest of the community sees this, like they got a subsidy, they're now rapidly elevated out of that category, and how do you balance that?
Interesting question. Does anybody want to start it? Joe's shaking his head. An honest dialogue.
It's a very honest dialogue, and frankly, it's been one of our greatest fears in this particular targeted subsidy. I recall, for instance, earlier when we wanted to try our very first pilot, we were stopped by one political leader because of some of these concerns where they feel that people will benefit knowing very well that they are not eligible. So for us as service providers, that is why we want a system that we can easily sort of iterate in a way that ensures that whoever is getting it is, as at the point of doing it, eligible to receive that kind of support. And it's if that gives us that level of comfort, then we will want to continue to do that. And of course, if you're able to do that in a simple, cost-effective way, then on an ongoing basis, we can be able to identify some of these outliers and deal with them. But as I said here, I don't really have an answer to this question. But it's a genuine concern, and I think we've taken note of that. Thank you. You want to?
Oh, no, I saw someone.
Another hand, all right.
More hands.
Thank you very much. My question is about government guidance. I think Louis mentioned Rwanda, and I know that it's one of those countries that has really tried to figure out data on who is poor and vulnerable and used it for even other things like health insurance and things like that. Do we have any other experience about governments setting guidelines to support selection like that? And then the other one is around...
Okay, one question. Only one question. Thank you. Hey, I don't know if you want to speak. Maybe Maya more?
Sure.
Sure.
I just have a quick comment, which is in our case, it's actually kind of been the opposite. So our government partners know that we're piloting these different subsidy targeting mechanisms and exploring like how do we identify the most vulnerable. And they're very interested in our results to hear how it could potentially be expanded to other programs beyond our own service.
Yeah, I think I started mentioning this in my presentation. There are countries that are like Rwanda that have databases and that they're using those databases for a number of social services, not just water and sanitation. And it is probably the most cost-effective way to do this. Particularly if you look at some of the most quoted in terms of researchers say this is the best examples come from Latin America. Places like Chile have rolled out, it's been decades for them now, large databases. It really just depends on like how you can collect this information and at what scale. If the government can do it at scale, then you can use that information at scale for different purposes as well. I would say Chile, Cambodia, Rwanda, these are all good examples of government-wide programs that have identified people.
I'm so sorry, we're out of time.
If there's one more burning question,
If you want to stay, we can take another one, but if you have a meeting, feel free to leave.
Yeah, no, I think this is the networking hours.
Yeah, it's the networking hours.
Or someone wants to ask.
That's great. All right, thank you so much to all our participants, and keep the conversation going.
Wow, they wanted more, that's a good way to leave them.
Thank you.
No, thank you. Well done.
So